welcome back to She Made a Podcast. I'm Ashley.
And I'm Kolbie.
And today we're doing a healthcare episode because we're both in healthcare. It makes sense. And we just read a book that was about being a nurse. So,
yes,
the puzzle pieces are fitting together.
Everything fits.
Yes, everything fits. So, this is your beginning of the episode warning. We will be talking about the book called The Nurse's Secret, whose author's name I cannot pronounce. It's Amanda something.
Amanda Skinnendor.
There we go. And we actually read this book for book club. Shameless plug. I run a book club. If you want to know more about it, go follow She's in a Book on Instagram. There you go. That's all you know about that.
We're dope as hell. Why would you not want to be in our book club?
We read books like the one we're going to discuss today.
Yep.
And this is your spoiler warning. If you have not read The Nurse's Secret and you think it's a book that you might want to read and not have spoilers for, you might not want to listen to this episode. Or, I don't know, maybe at some point I'll do timestamps so you know what to skip to not get spoilers, but no promises.
No, guys, we're still living on top of boxes right now, so we're not there yet for timestamps yet.
I'm sitting on a pillow throne. All right, so we're gonna jump right in, and you're wondering, what do these two girls who are completely unhinged know about healthcare? A lot, actually.
Yes,
you'll be surprised. I think we have over 20 years combined experience in the healthcare field.
Yep,
vastly different sides of it, though.
Could not be any more opposite.
And for me personally, I was in the military doing military healthcare for the first 10 years of my healthcare journey, specifically working in the OR as a scrub tech and doing urology surgery, but also on the clinic side of it, because in the military you have to be very well-rounded, very flexible. So we were bouncing back and forth, which was really interesting because you were able to follow patients from the clinic getting diagnosis up into surgery, actually fixing what their problems were, which is super cool.
That's really nice.
But for the last almost 2 years, I have been on what we call the civilian side, working in a hospital strictly as an OR tech on the urology service. So I've nearly 12 years of urology surgery experience and also trauma experience as well, because you learn a lot of that being in the military.
Oh, so I thought you meant like just being a healthcare worker is traumatic. I thought that's where you were going with that.
Also that.
That's wild. 12 years? It's been that long?
In July, it'll be 12 years, yeah.
Dang. I mean, you must have started when you were like 5.
Must have. Thank you. And like I said, Kolbie's experience is vastly different than what I've gone through.
On the totally opposite end of the spectrum, where Ashley had to be very well-rounded in the military, I am a travel nurse and I do not have to be well-rounded. I am in a specialty. So I am a pediatric oncology travel nurse. I've been traveling for 3 years and this is my 9th year nursing, which blows my mind. And so what I enjoy about it is something that you just mentioned when you were in the military side of it, is that you follow patients from beginning to end. And I love that. Mm-hmm. And that's kind of what we get with pediatric oncology. They come in, everybody I know, let me just preface this. No, it is not the saddest, most heart-wrenching thing that you've ever done in your life. Yes, there are days where I come home and I just cry and sob and all the things. But, most of my days are filled with so much joy from these kids. Like, mm-hmm. It's not what people think. But anyways, I enjoy it because in med-surg or in the ER, it's like fix them and ship them. You ship them off to another department. And in peds oncology, we get them. We get a kiddo. We get their diagnosis going. We start them on meds. We start them on chemo. And then we follow them all the way through their journey, whether they're going to get a bone marrow transplant or they get in remission from their chemo and radiation, anything like that. So I love having that relationship with my kiddos and their families. So that's what I do. I've only done 1 year of a different service, and I actually started out, my first nursing job ever was bariatric surgery recovery.
Mm, I bet that was so fun.
Wild. Wild. It was like the wild,
Ooh.
wild west. Okay.
Yes.
So, yeah, here we are. And while we're at it, travel nurses, are you okay? Are we okay? We're not
You're not
okay.
okay.
We're not okay. There are there's not many jobs for us tiny human specialists out there right now.
Mm-hmm.
I've been trying to find a job since December, which doesn't sound long, but in travel nursing, it's like a job
Yeah.
gets posted and then it's filled within days.
Mm-hmm.
So it feels like I've been looking for a job for a year, and my husband is very ready for me to go back to work, guys. So if you're a recruiter or you know one, hit your girl up.
Said, hook a girl up, please.
Please. I would like a paycheck.
Mm. Okay, so I gifted my copy of the book to the person that recommended the book for book club. So I don't have a physical copy with me, so we're going strictly based off memory here.
Okay, cool.
You did finish reading it.
Oh, yeah. I finished it that day.
Perfect. Okay, so we read The Nurse Secret for our book club, and it was picked out by one of my good friends who's also a nurse. I am not a nurse. I just want to remind you all. I just work with a lot of nurses. I have a lot of friends who are nurses.
Yep.
So, by association, I can appreciate your struggle as a nurse. And you could not pay me enough to be a nurse. Okay?
Nope.
I will keep being a scrub tech, working with the surgeons, getting elbow deep in the guts. I will do that to not have to wipe poop off of someone. Okay?
That just blows my mind. I'd rather dig in your guts than wipe your butt.
Yeah. And bless the CRNAs because the loogie on the end of the tube, I got, whoo, girl. And we were in the OR and a little loogie had gotten on the bed and I went to wipe it. And as I was wiping, I saw what it was. And I was like, I got to look away so I don't gag. And when I tell you, when I went to look away and what my eye caught was them pulling the tube out of the patient with a, oh,
Okay.
I had to leave the room and thank God for my nurse because she knows it was one of my besties. She could hear me gagging in the hallway.
That's one of those times where I'm really grateful for a mask because I'm back there behind that thing going, Loogies are not.
And I cannot control it. I try so hard to suppress. Whoo. Oh, it gives me the chills right now. Just
no. Give me a GI bleed. Give me vomit and blood and literally any other liquid that comes out of your body. But if you are sucking snot or you have loogies, I'm sorry. Like when I worked in the PICU and we had intubated patients and it would be like, somebody call respiratory. Your girl's going down.
So I have a mad appreciation for all the nurses that I work with because a girl could never.
Nope.
So what I thought was super cool about this book in particular is it is historically accurate. So it's a historical fiction that is also like a whodunit murder mystery. Mm-hmm. And at the very beginning, I was confused about how we were going to get from point A to point B, being a pickpocket to becoming a nurse.
Same.
I started the book and I was like, I thought this was
Where's the nurse?
Where's the nurse? Where is she? And I told the person that had recommended the book, I was like, I'm just a little confused. And she said, wait till you get about 70 pages in, then it gets you there. And I'm like, okay.
It's so true. Because I started and I was like, did she put the wrong cover on here? I'm confused. Right? Yeah.
So for those who have not read the book that are here and don't care about spoilers, basically she hides in a nursing school Bellevue, which is actually one of the first nursing schools that was in New York. And so that's like the fun historical aspect of it, because it gives you the history of the school, and it has some very famous doctors that it mentions in there, like
Mhm.
Dr. Lister, who was known as the germ doctor.
Yep.
So whenever you're in the field and you read a book like that, it's really cool to kind of like see the little shout outs to what the real things were.
Yes.
So she's hiding out in nursing school because that's where criminals hide, apparently. But she actually did
It's
really
not
well.
wrong. That part is still accurate. I know historical there, it's just accurate.
Yes. But it was, and I had talked to some of my nursing friends, and I was like, how do you feel the nurse doctor relationship that was portrayed in the books versus how it is now? And they were all telling me, especially in surgery, because that's where I work and the nurses work. So we were able to relate heavily to that,
Mm-hmm.
that you do have the older doctors, even now in today, modern society, that are not for the what they call the new age medicine, which
Nope.
is so starkly different from what new age medicine in the historical period was. But
Mind
how, like,
blowing.
like, it's just crazy to me that as a doctor, like, things are going to advance and develop, and like to resist that is so weird to me.
That, but it's so, in the book, it's such a great representation
Mm-hmm.
of that, of the different generations, because there are the younger residents in the book. And then
Mm-hmm.
there's always the older, uh, not resident, the older attending
Yep.
who's like,
Put
oh, I
some
have a
let
question.
some
Who can
fresh
give me
air
an,
blow on it.
yes, yeah. Somebody open a window around here. Let's leave this wound wide open and let the dust circulate. It'll be fine.
It'll be great.
Uh, I'm sorry,
Excuse
sir. I'm sorry, sir. Where did you go to school? Why are you so worried about where I went to nursing school? Where did you go to medical school?
me. Really. I will say though, at least I think it's different between the floor interaction with doctors and nurses versus like in the OR, because in
Mm-hmm.
the OR it is a team working
Yeah.
for that patient in real time. So it is much more collaborative than
Mm-hmm.
on the floor where the doctors just do their rounds and they're like, do this, this, and this, bye. Whereas like in the OR, you are actively like working on that patient together,
Mm-hmm.
and you build more of a camaraderie, especially if you're on a team and you're working with those same doctors every single day.
Yes. I
So it
agree
is
with
different in
that.
that sense as well.
From my experience with that, in my specialty, it's very similar to yours. We do have that
Mm-hmm.
relationship with the doctors and residents and basically the entire team for that patient, because it never changes. It's not like you're on a med surg unit where it's like, oh, one day we
Yeah.
might see a cardiologist and I might not have another heart patient for 4 months and I'm not going to see them again. We
Yeah.
work very closely with the same doctors, nurse practitioners, pharmacists. And so it is very much like a team effort in real time and on the floor. And I've never been in surgery, so I can't speak to this at all. But the one thing I feel like is very different in a unit like oncology is that the nurses actually have a lot of autonomy, because in this field, you're so experienced and you see the same things over and over. And the doctors are like, okay, we've seen this before. You know what to do. Here's what you can, here's like a list of things you can choose
Mm-hmm.
from to do. If it doesn't work, give me a call. You know what I
Yeah.
mean? Is that any similar? Like,
It
do
was
you have
like
a lot of
that.
autonomy?
Well, it's not even the conversation doesn't even happen. Like, you just know.
Yeah. Yeah. You just do
And
it.
then even on the military side of things, when I worked in clinic with these doctors, I was
Mhm.
there for so long and like working with the doctor for so long that I would basically see a patient for them and then come to their office and be like, hey, this is what's going on. I think we should do this. And he's like, you got it. I'll sign it. Like,
Exactly. Exactly.
so
Which is
yeah,
great. But also, like, can I get paid for that?
on it.
And that's one of the things. I, it's probably the same in the OR. Every July, you get the new residents. Do y'all get that? July is the, if you go back and look at my work history as a travel nurse, my contracts end in the beginning of July. And I don't start again until like August or September. I'm like, yo, get those newbies under control. I'll be
Yes.
back. But it's basically like sometimes you have those really thorough residents and they're like, okay, I don't, like you just said, I don't know this patient. Give me a report on him before you help him pee, so his bladder doesn't explode. And they want this full rundown, which great, awesome, whatever. But then you have those other residents and they're like, no, yeah, whatever you think. Like, you're the nurse, you've been with him all day. Go for it.
We love
Those
those.
are the ones we love. Applause for the residents who trust their nurses. Thank you.
Yes.
I just, dude. I don't
Okay,
have
but
MD
quick,
after my name, but shit, I know.
literally, quick, bring it back to the book. Let's rate the book and then we can
How about that?
keep going.
Yes.
So, what did you rate this one?
So on my feelings rating, I did love, 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 which for me would be a 4-star.
Okay.
And if I was really giving it a number, I would give it like a 3.8. And my only reason is because it's a lot of buildup and I was so amped and like really, really loved all the detail and the accuracy. And then I felt like the end just happened so fast.
Yes.
But also the ending came completely out of left field for me. So I really enjoyed that. What would you give it?
I would have rated it 4 stars.
Okay.
Simply because I loved it. It was so good.
Yes.
I would have never picked it up myself.
Yep.
So that is why. If it was a book that like I would have picked up on my own, easy 5 stars. But because I would have never branched out and read that book had it not been the book club book, 4 stars.
That's
but
totally
I did
fair.
love it.
If it had Faye in it, would you give it 5 stars?
Well, and that's the thing. Like, if it had Faye in it and I had read the blurb and I would have been like, oh yeah, I want to read this book, then yeah, it could have been a 5-star book.
Okay. Just have to sprinkle a little bit of magic in there. No, seriously, this is one of their historical fiction is a hit or miss for me. Like it's either I love it or I really can't get into it. And this book was so easy to just immediately jump into and love the characters and the tone. I love how it's written in like the 1800s British slang and like her sentences, like some of them were like not proper English. I loved it. I loved every bit of that. And I know some people struggle to read that. And I was like, I was meant for this. I was meant to read incorrect grammar. I loved it. But no, for real, 10 out of 10.
Raised in the South.
That is on being raised in the South, y'all. 10 out of, like, I love this book. If you can see it. Can you see that? Okay.
Yeah.
Plugging this in there.
Okay. So, being an essential worker, that was, first of all, at the time, we're talking pandemic, you guys. We're going to talk about it because we were both there when it happened in the trenches. When people said essential worker, how did it make you feel? Just the phrase essential worker.
In the beginning, I loved it.
Okay.
You're essential. I'm the shit. I'm essential. Everybody else gets to stay home and not go to work. I'm essential. I can't stay home and go to bed.
Okay, but six months in, how did you feel about it?
I would rather muck horse stalls for the rest of my friggin' life than be called an essential worker. I swear to God.
At the beginning, you're like, okay, this is cool. I'm special. I'm essential. Like, 2 weeks of a pandemic. I can do this.
Okay, but also low-key how everyone thought this pandemic was actually going to last for like 2 weeks, maybe a month.
Maybe.
Are we out of it yet? Are we done? Are we there?
No.
Okay, cool. Just making sure.
I would say no, simply because we are still COVID testing all of our patients.
Yes. We're still COVID testing. I'm not in the hospital right now, but the hospitals that I still keep, like I have friends that I keep up with, they're back to masking.
Well, because a new strain, it's almost like it's a flu, and a new
It's
strain comes out every year. We'll let that simmer. I
there will forever
digress.
be there will forever. Okay, yeah, I can't get into that.
So, at the beginning of the pandemic, it was great because
Yeah.
we had it to where we were switching on and off. So, like, we split our crew up because if the patient is not like an emergent patient, like they're about to die, they were
Mm-hmm.
canceled.
Yep.
So we had like a 0 patient load. We literally kept like half the staff at the clinic in case someone walked in retention or like bleeding out of their penis,
Yeah.
just in case. So we were working like 1 week on, 1 week off
Uh-huh.
for the
That's
first.
so great.
Yeah, it was great. I was like, I'm essential. Yay. 3 months in, um, they wanted us to go back to full capacity of seeing patients, but everyone had to be seated 6 feet apart in the waiting room.
Mm-hmm.
So we could only fit like 10 patients in the waiting room.
Yeah.
Everyone's wearing masks. We had, oh my God, not the clear plexiglass shields on all the desks.
On all the desk.
All
Plus, the
desk.
people behind them are probably wearing shields.
When I tell you, God, I loved our patients. I promise I love taking care of people and being in the healthcare field. I need something to. Okay, let's. Okay, This shirt's gonna be the shield, right? Okay. So we have the shield,
Okay.
and it's clear. Okay, so this it's clear.
Okay.
Can I make an appointment?
Also, you have to do the. Can I make an appointment
Yes.
with the mask?
Can I make an appointment? I'm like, I can see you. I can hear you through the clear window.
Sir, it's just plexiglass. It is not a window.
Plexiglass.
And your paper mask, I hate to break it to you, but I can still hear you.
Yeah.
Unfortunately, I can still hear you.
And I think that's another thing that cracked me up is like they always pull the mask down and talk to you, and like that's literally when you need to have it up.
Yes.
It's
Please
when you're
stop spitting on
pushing
me,
the
sir.
air out of your mouth. I think that's probably like one of my funniest things during the pandemic was we had the clear shields, and they would. I need to make an appointment. I'm like, can you please get back behind the shield, please?
And pull up your mask. Pull your mask up. How many times a day did you say that? Pull your mask up.
And not just to patients, to my
Oh, God,
coworkers.
no. Well, yeah, I was one of those. I was one of those people. My experience in the beginning of the pandemic was vastly different than yours, where you were like,
Okay.
this is great. I'm straight chilling. I ain't got no patience. Mine was a little different. So at the hospital that I worked at, I worked a split position. So I worked in the HEMOC unit and I also worked in the PICU. Okay. So if I was scheduled for HEMOC that day, lucky me, because those are the cleanest patients in the hospital, right? They have no immune system. So we're like basically bathing before you walk into the unit and hand sanitizer, and we're in the bunny suits. I'm not kidding you. We were in the bunny suits and the shoe covers and the nets for your hair, like everything. N95 with a regular mask on top of it, goggles, face shield, all the things. Okay, so you knew you were going to sweat your balls off if you were on that unit that day, but you were good. Okay, so if I was in PICU, our PICU basically, unless it was like a kid that had been there already and was like vented or something, that basically became our COVID unit. So it would be regular med surge kids. It would be like lower acuity, but it was only COVID. And if you've ever worked in a PICU or just in an inpatient facility, if you have a patient that's on isolation, there's an ISO cart that sits outside of their room, right? So that you can get whatever you need for that patient. All right. I will not ever say the name of where I worked. Okay. But they started rationing. I mean, you probably remember it. Everybody that was in healthcare remembers when they started rationing our PPE, which is your personal protective equipment. Okay.
Mhm.
We were
My
literally,
my N95 stayed in a cute little brown paper bag in my
yes,
locker.
yes, for a week. So,
Oh,
however many shifts, well, ours was a
longer.
week. Well, okay, but I was on a, when I
Yeah.
was on a COVID unit. I was in and out of
Hmm.
patients' rooms. And then at the end of the day, it's like, oh, we're going to drop this in a paper bag and all your germs are just going to magically go away for your other 2 shifts this
And you
week.
had to take it off very special too. Like,
Yes. It was it was insane. And so I remember them coming. I remember actually we heard about it first. Hey, they're coming around to take ISO carts away. Y'all, when I tell you that it was like, what was that TV show? The Supermarket Dash? We were running around. We were hiding shit in drawers. We were like, take the gloves, take the yellow jumpsuits, take everything you can and hide it. And it's like, they took it away. And then at the beginning of every shift, they'd be like, okay, how many patients do you have? This is how many ISO suits you're going to get. This is how many masks you're going to get. This is how many sets of goggles and gloves you're going to get. And I'm like, I'm sorry, sir. I have a 2-year-old that has COVID who can't have any family members in the room with them. Okay. So every time that something happens, an alarm goes off or they start crying, or, I mean, God forbid, they're not potty trained. Every time they need a diaper change,
yeah.
I have to go in the room. You can't limit how many, I mean, they were like limiting how many times you could go into the room. And
Which is wild.
it was bonkers. And so the beginning of COVID for us was horrible, like in that sense. And then they started to figure out, okay, maybe we'll give them a little bit more leniency. You get a little bit more supplies. They would let us run our IV poles and pumps. They'd let us have really, really long tubing, and you could have the pump outside of the room. Have you ever seen that?
No, but that,
Okay,
but you're still limiting contact with the patient, which is like frustrating to me because
100%.
for a patient's recovery, they need human contact. Like, that's
Absolutely.
science. There's been studies done.
Absolutely. And not to mention their kids, and they
Yeah.
couldn't have their parents or guardians or anybody else there with them.
Hmm.
And it's not like, I hate to say this, but we couldn't go in the room and like spend a significant amount of time in there, like playing a game or like a simple card game, nothing that
Yeah.
is exerting any physical activity, but we're soaking wet with sweat, like all the way through our
Hmm.
clothes. We can't breathe through those masks. We can't stay in there with your child that entire time. It was a terrible feeling as a nurse. I honestly felt so out of control
Yeah.
in the beginning. So like it was insane.
I only had like one time when I kind of experienced that, and it was literally 2 years into the pandemic. Like, because so I spent the pandemic in California, Southern California, and literally the week that we were going to move from California to Tennessee, my oldest, his appendix ruptured.
Oh my god.
So we spent a week
I
in,
forgot about that.
yes, we spent a week in the PICU with him on IV antibiotics. And if the, so me and my husband could switch out, but if you had a child and that child was not a patient on the ward, they were not
Mhm.
allowed on that floor.
Yep.
Two problems with that. What if you're a single parent
Yep.
to multiple children? So now, like,
Who has them?
who has your other child? One. And two, if you don't have someone, now, like, you can't go visit your own child who is sick.
Mhm. Mhm.
And two, my kids are very close to each other.
Yeah.
My oldest, the third day in, had not got to see his little brother in almost 4 days because of
Yeah.
when he was admitted. And he's asking, he, in his little brain, he thinks that his brother doesn't want to see him because he's a
Yes.
kid.
Yeah.
So he's like, why hasn't brother come to visit me? And we had to explain to him no, he had just turned 6,
Mhm.
right? Or he was either 5 or
In
6 at the time.
2020?
So I'm explaining to a
Yeah.
5 or 6 year old that the hospital will not allow his little brother to come visit him. So we
Mm-hmm.
finally got him stable enough to where they would take him off the antibiotics for a couple hours so he could leave the hospital building, go outside
Mm-hmm.
into the courtyard so he
Yeah.
could see his little brother.
It's that is people don't realize how much having someone with you that you
Mm-hmm.
know that loves you,
Yeah.
anything like that. It doesn't even have to be a family member, a friend, a neighbor, a coworker, just to have someone to come visit you. It is scientifically proven that that
To
helps
help the
with
healing.
recovery.
Yeah.
Yes. And you probably had to do this too, but as far as like switching out, when parents would switch out to come see their kid, you couldn't just be like, "Oh, my husband is at the front door of the unit. We're going to switch out." No, you had to go all the way out of the hospital into
Mm-hmm.
like a parking garage or something before the other one could come inside the hospital building.
Yep.
Like, what are we doing here?
Yeah.
I don't know. It was mind blowing.
And that
I
was like,
totally forgot about that for you.
yeah. And that's like kind of when I got to see firsthand how it was affecting kids, right? Because there was literally in the PICU, there the nurses had their little nurses station, and there was a baby in the PICU, not even like
Mm-hmm.
a year old, but they would wheel the little like the little bassinet out to the nurses station. That way, the nurses could hang out with the baby,
Yep.
and it wasn't just in the room by itself.
Yep.
And then there were other kids that were like 1 and 2 years old that their parents weren't there,
Uh huh.
and they also don't have enough nurses like to
Ever.
be,
No.
yeah. And I just think about like those little babies just sitting by themselves in
Yes.
isolation, already sick all day
Yes.
long because their parents are having to work to pay for the astronomical hospital stay that they're doing, and you don't have
Mm-hmm.
enough nurses to really nurture those babies. Like that's just
No,
wild to me.
because at that time, it really should be like a 1 to 2 ratio
Yeah.
so that you have time to go in and not just do the things that you have to do, but do the things that you need to do and you want to do, like
Mm-hmm.
swaddle the baby and hold them up close to you so that they can like feel like there's another human being in the room with them,
Yeah.
you know, and put them back down. And you can't do that because at the time we would have like 4 or 5 patients. And that
Mm-hmm.
alone, we don't even have time to get their meds to them on time, much
Yeah.
less do anything else. Help them to the bathroom. That was such a big thing with our teenagers, especially our teenage boys, our athletes. When they would come in and they would have COVID,
Mm-hmm.
respiratory distress was so huge. And these like 6 foot, 200 pound football player, 16, 17, 18-year-old
Mm-hmm.
boys couldn't get to the bathroom on their own. And then they don't want to ask for help, you know? So it's like you have to watch them. Oh,
Yep.
they trying to get up out of the bed. What they doing in there? And so it's like wait there. It just wasn't. It was not
Yeah.
a good time. But
It was
also
not a good
like
time.
what you're saying about like when your little boy was in the hospital for oncology patients, it was like a world change overnight for them because they live in the hospital
Yeah.
essentially, right? For months and months at a time, especially bone marrow transplant kiddos. So the parent that was already there at the hospital had to stay. Okay.
That's
So not
wild.
only
Forget
are,
that they might have a job. Like,
yeah, if they had to leave and go to work, sorry,
can't come
you
back.
can't come back. So it was like we were playing social worker,
Mm-hmm.
nurse, counselor, all the I mean, at that point, we went back to the time that this book was written because in this book,
Yeah.
nurses are housekeeping, they
Mm-hmm.
are talking to patients, they're making food for patients, I mean, literally everything. We were
Mm-hmm.
taking clothes from family members to washing machines. I mean, I remember that I had a kiddo in the PICU. I'm glad I'm not saying where I worked because I could probably get in trouble for this. But
Yeah.
a patient that was a HEMOC kiddo that ended up getting COVID, okay, got put into the ICU. And her favorite blanket was like soiled. Okay. And they
Mm-hmm.
wouldn't let us take it out of the room. They're like, no, you can't use the public washing machines that we use for the other kiddos. I put that shit in a garbage bag and I took it home and I disinfected it. I washed it like 3 different times and I brought it back my next shift. And I was like, it is unreal. It's
Yeah.
little things like this that are that are so important when these kids are in the hospital. I could go on a
Yes.
soapbox rant forever, but this book, this book was
Hmm.
not written during a pandemic. This was just like their normal everyday thing.
Yeah.
But for us, I mean, we were wiping down rooms because if they were a COVID room, we had a separate housekeeping team. Did y'all
Hmm.
have a separate housekeeping team?
We didn't have a separate housekeeping team, but they had like put these huge tubings ran out of I think they had closed down two ORs specifically at the end of the hallway.
Mm-hmm.
And those were our COVID rooms.
Uh-huh.
And they were like blocked off, sealed with plastic zipper doors
Yep.
to get even into that hallway. The doors were blocked from the inside. Like people that have been in the OR and like OR
Mm-hmm.
techs, you'll know like you have the doors that go into a pod or like the sterile core. Those were completely blocked off.
Is that similar to like an ante room?
Yeah.
Okay.
So then you had these huge, huge white tubings. Like, I don't know if you can, how wide my
Yeah.
screen is, but they like ran through a hole and then out a window. So, like,
So
the
there was a
same air did not even circulate back into the hospital. It was like circulated outside the hospital.
y'all didn't have like pressurized rooms where you could change the airflow?
Not in the OR, no. They had them
Oh,
like
I
down in the ER. So we had to
I
like
never
create
thought about
those, like create those
that.
spaces. Yeah.
I never thought about that.
Hmm. And then in trauma centers, they don't have like the decompression areas, but
Mm-hmm.
in the trauma rooms, they have the negative pressure in the rooms,
Yes.
but all the other rooms are positive pressure. So at the hospital that I'm at currently, that's the rooms that they use for any COVID patients now because they're negative pressure.
Okay. Okay. For anyone who doesn't work in healthcare, should we explain what the difference between negative and
Yeah,
positive
so a
pressure rooms are?
negative pressure means the room that you're in, the air gets pulled out through a special HVAC filter system.
Yes.
So instead of it like being able to like flow out of the door or flow out this way, the room kind of sucks it back up into
Mm-hmm.
a vent.
It's like a
Whereas a
vacuum.
positive pressure, it all gets pushed out.
Yes.
So like when you open
Like
a
a normal
door,
room.
air flows out like a normal room.
Yes.
So
Yeah.
that's the difference.
So, but that's also something you don't think about until you're in a situation
Hmm.
like the pandemic.
Yeah.
I don't know. It just this book really took me back. I was like, man,
Yeah.
this is like the 1800s. We're the nurses are doing all the things here, you
Hmm.
know. And then you
Yes.
have people that were doing jobs that weren't their jobs. If that makes any sense. Like we
Hmm.
would have just to keep people making money. Like how you mentioned that
Yeah.
y'all would get called off. Do you know how many times we would have, not on the COVID unit, but on regular units, we would have like just random, like a surgical tech that was called off for a shift or something, come in and be a sitter, which was fantastic for your nurses and
Yeah.
for you guys so that you could get paid. But it was like, it, that's what we were trying to do, was like create ways for people to still have their job.
Yeah.
It was wild.
Because
It was a
bills
crazy
still need
time.
to be paid.
Yeah, exactly. The bill still had to get paid and the patient
Hmm.
still had to get taken care of. And there's just not enough time in the day and there's not enough people in the hospital.
No, there's not.
So, wow, that just went
Yes, it did. Moving on to a lighter
PTSD.
note. Yes. On to a lighter note. This is becoming a favorite part of mine of the podcast is the BuzzFeed quizzes.
Yes, I
So
love
let
it.
me get them pulled up. Oh, I'm so excited. So which one do you want to do first?
I want to do the one the treatments, real or nah.
Okay, we'll do that one first then.
Okay, you pull that one up and then I'll pull up the second one. Let's do
Okay.
both of them. Why not? Okay. All right. I'm ready for yours. Let's do it.
Okay. So our first quiz is about different illnesses and if they're real or not. So it's kind of like a true or false quiz. So the first one is bloodletting. a procedure that started with the ancient Egyptians and stuck around until the 19th century. It involved removing sometimes large quantities of blood from the body, usually by cutting into the vein in the forearm, but also by applying leeches, in order to treat all sorts of illnesses, including the plague, smallpox, and epilepsy. Doctors did this because they believed illnesses were caused by an imbalance in bodily fluids and that by removing blood, it would restore balance. Real or not real?
Real. I've heard of that.
Real. Definitely real. It was literally in the book we read too about them using the
I know.
leeches.
I was thinking about that.
So, yes, bloodletting is real.
I think that there are still some countries that do that.
Probably.
Whoa.
Okay. Trepanation.
Okay.
Performed for thousands of years from prehistoric times into the 19th century, trepanation was a procedure where doctors would drill or create a hole in a patient's skull to expose the brain, often without pain medicine or anesthesia. It was believed that doing so would help treat hysteria or psychosis.
Okay, I want to say that's real, but I don't think that that's the name of it. The name that I've heard. It's like a lobotomy. Okay, yeah, I'm going to go with real.
It's real. Yeah.
Okay, I read a book called The Lobotomist Wife, and I was like, they did
Of
that.
course you did.
They did that. Okay, cool. Yikes.
All right.
What a time to be alive.
Right? Thank God we're in the 21st century.
Mm. We're still putting plastic
Okay.
over doors.
Right? Yellow fever baths. In the late 1800s, before discovering that yellow fever was caused by a virus spread by mosquitoes, doctors would bathe their patients in cold milk baths, hoping that they would cool the patients down while also extracting the sickness through osmosis. Real or not real?
Real?
Remember, this is the 1800s.
I mean, that sounds absolutely bonkers, but I'm going to say, yeah, that's probably some shit they did.
It wasn't real. So believable, but it was not real.
They had me going there. I was
Yes.
like, the milk, though.
The milk.
Okay, well, whatever. Thank God they didn't do that because it was
Oh,
not going to
God.
work anyways.
No, it was not. Okay. Hemiglossectomy. Thought to cure stuttering and other speech defects, hemiglossectomies involved cutting off half or part of the tongue. It was mostly practiced during the medieval era, but continued until the 17th century before it was ended for being inhumane and ineffective.
No way that's real. No way.
It's real.
They cut off people's tongues? Because they had a lisp? They thought that they were.
Oh my
They thought it was the tongue.
It said it was done with crude instruments and no anesthesia. Today, glossectomies might be done under anesthesia, but only when a patient has mouth cancer or another oral disease.
I was about to say, you are not cutting off tongues for a lisp. Yeah, like how back in the day were they cauterizing that shit?
Girl, they weren't. What do you mean?
That's sketchy. Okay.
Oh my gosh. Okay. Plugging therapy. During the height of World War I, factory workers making weapons like shells and bullets worked long hours, and it was often hot. To combat the excessive sweating from these conditions, the doctors would tell them to rub wax in the areas most affected by sweat. This clogged the pores temporarily and reduced sweating significantly. No way.
There's no way.
Yep, not real. We got that one right.
No.
Absolutely not.
Thank God.
Oh, this is interesting. Urine therapy.
Oh, geez. This is your area of expertise.
Coming from ancient Indian medicine, urine therapy was based on the belief that urine was the filtered and purified gold of the blood. So people would drink their own urine and massage it into their skin to treat stings, minor illnesses, and even some cancers.
That has to be real because people still pee on like jellyfish stings today.
Yep.
That's right.
Fair
Liquid
warning.
gold, baby.
I just want everyone to know urine will not cure your cancer.
No.
Okay?
No.
Okay.
It might cure your jellyfish sting, but that's
Yes,
about it. Dang.
Final shocking. a procedure from the late 1800s that involved injecting a saline solution into a person's neck and then shocking their brains, specifically the cerebellum. That will forever live on the internet. Thank you. With small
Cerebral.
currents of electricity, it was believed that the currents would stimulate the growth of neural connections and improve a person's IQ. The saline solution served as a conduit for the electrical currents to reach the brain.
I feel
I'm
like
going to
that's
say
probably real.
not real, but the science that they put into this fake answer, I can
That's
appreciate.
that's why I'm going to say it's real. I feel like that's too in depth to not be real.
Not real.
Those bastards.
Those
Good job. You knew. You were
to
like,
raise
okay.
your IQ, we're going to stimulate your brain to raise. Okay, no.
I mean, they also thought that they could pee their way out of having cancer.
True.
Okay.
The electric belt, similar to those ab stimulator belts that exist today, you know, the ones that don't actually give you six-pack abs. The electric belt consisted of several battery cells linked around a belt and capable of delivering electric currents and stimulation to the abdomen in order to promote digestion and treat erectile dysfunction. It's going to be a no for me, dog.
Okay. They had me up until what they were treating.
Yes,
I
that's
don't
going
think
to be a
that's
no
real.
for me.
Shut up.
It's
It's not
real.
real. Wait a minute. They were shocking men that had erectile dysfunction. Yep. That's going to do it.
Oh, okay. It was created in 1850 and phased out as a medical treatment in the 1950s. The belt was sold by a quack doctor to unknowing people who dealt with erectile dysfunction. You can sell a man anything to make his penis work. Let me tell you right
That's like those gas station
now.
pills. Have you ever seen those? You like walk up to the register and it's like, oh, make your penis grow 5 inches in 5
Listen, if
minutes.
you tell a man it can make his penis harder or longer, he's gonna buy it.
That is,
100%.
there are a lot of men from the 30s, 40s, 50s that probably got worse erectile dysfunction from shocking their penis.
Literally.
But like also the fact that it would happen up until the 1950s?
Yeah.
Dude, our grandparents were alive then. That's not that long ago. I don't like it. I don't like it.
Okay. Heliotherapy for tuberculosis.
Okay.
Patients, specifically those with pulmonary tuberculosis, were told to take air baths, first for as little as 5 minutes per day before increasing their exposure to fresh air over time. Then, once habituated to the air for a period of an hour or more, they could begin taking sun baths, which is heliotherapy, while also increasing their exposure each day. Once acclimated, patients could expose themselves to the sun for as long as necessary, as long as they weren't getting sunburned. This exposure was believed to improve symptoms. Yeah, I would say they probably did do
That's
that.
probably real.
They they used to open windows to cure infection. So,
That's true.
yeah, it
Sunshine.
was real.
Okay.
Yeah.
That makes sense. That makes sense. Sunshine does
Okay.
cure a lot of things. I'm just saying.
It does. Farts in a jar.
Okay.
Hear
Oh,
me out.
no. Already
Hear me
no.
out. In 1665, during the Great Plague of London, doctors believed that the illness was caused by deadly vapors in the air. They thought these vapors could be fought through exposure to equally foul smelling vapors, so they told their patients to fart in jars. When the plague reached their patients' towns, they could open the jar and inhale the gas inside.
Those towns had to smell like absolute ass.
So
There's
we're going to
no
say
way
not
that's
real?
real. No. Shut up. No, it's not real. You're telling me that a grown ass man farted in a jar. Okay, but why do I feel
Yes.
like I've seen this on the internet still? Like people, have you ever seen that? There are fetishes for
Not
that where people
for
literally, have you seen that where people will
not for
pay
like
these
medical reasons anymore, but yeah, for fetishes.
eh,
I don't
I'm
need no
serious.
fart in
Actually,
nobody's jar.
those towns had to smell like just straight up. Oh, the plague is coming. Everyone open your fart jars. No way. Everyone's
Yes,
just send your husbands outside. It's fine. You don't
truly,
need it in a jar.
truly. Okay. I think this is the last one. Yeah, this is the last
Okay.
one. The Hippocratic bench.
Okay.
First described in the 5th century BCE, the Hippocratic bench was one of the first forms of treatment for spinal deformities, including scoliosis. Depending on what needed fixing, patients would lie down on the table, have certain parts of their lower limbs and upper bodies tied with ropes or bands, and then have the ropes pulled upward and downward in an effort to stretch the spine straight.
I think that's true.
Yeah, I think that's true as well.
I think that's real.
Yep.
Those poor people.
Those poor, poor
Those
people.
poor people that are stretched.
That
That's
was good.
wild. Okay. Is that the end of yours?
Your
That one was
turn.
good. I loved that one. All right.
That was good.
I'm going to be
I'm
so
ready.
embarrassed. This one's going to be embarrassing because if we get it wrong. Okay.
Embarrassing
So,
for you.
yes. No, because you know it.
Listen,
You're gonna crush this. This is
I'm
like
gonna like I work in surgery. If I don't
yes.
know who these ologists are and what their specialties are, ooh.
Yeah, this is gonna be worse for you than it is for me. Okay. What kind of doctor specializes in the heart and blood vessels? Sanguiologist, cardiologist, choreologist, or radiologist?
Do you know?
I'm gonna go with the cardiologist.
Yeah, cardiologist. That's the easy one. Getting us warmed up.
Correct. All right. What kind of doctor would you see for problems with your ankle or feet? A footologist,
Oh, for sure.
rheumatologist, a pediatrician, or a podiatrist?
I'll take a podiatrist for 200.
Yes, you would be correct. Okay, maybe this is not as bad as I thought it was going to be. What does an otolaryngol...
Sound it out, Kolbie.
Actually, I have to. Okay. I can read it just fine, but I can't make it come out of my mouth. What does an otolaryngol...
Laryngologist.
Yeah, can you say the whole word?
Otolaryngologist.
Thank you. My mind could not get that g to make a g sound. Okay. What do they specialize in? The nervous system, digestive organs, ear, nose, and throat, or nice try, that's not a real doctor.
Do you know?
I do believe that's an ENT. That's an ear, nose, and throat doctor. I can't say it, but I do believe. Yes, we are
ENT.
correct. Oh, wow, that was hard.
That was entertaining.
That was painful for me. I'm sweating. What kind of doctor specializes in vision and eye care? Eukaryoologist, orthodontist, physiologist, ophthalmologist.
What was the first option again?
Eukaryoologist. I can spell it for you.
That's hilarious.
EUKARY-ologist.
I love the pronunciation. Eukaryoologist. You care. I don't know.
You care. I don't care, but you care.
Oh, it would be D.
D. Ophthalmologist. You are correct.
Yes. Thank you. Thank you.
Okay, this is way too easy. I thought it was going to be harder than this. What kind of doctor would you go to for medical imaging, such as x-rays? Phlebotomist.
Ooh, don't give me the options. Ready? I know this one.
Okay.
Radiologist.
Great job. Actually, that's how we're going to finish this.
Oh, no.
What does a dermatologist specialize in?
Oh, skin.
Okay. Actually, let me give you the choices for this one.
Okay.
Hair, skin, nails.
All of the above.
Okay. What doctor specializes in the nervous system? I'm not
A
giving you
neurologist.
Yeah, let's see. Yep, neurologist. That's some interesting. Spiniologist, cerebellumist. They're just making shit up at this point.
Oh, yeah, for sure.
What does an oncologist specialize in?
Cancer.
Correct. What kind of doctor would you go to for respiratory problems? You know this.
Pulmonologist?
Correct. Pulmonologist.
I had to think of the word.
I know. I was like, I can see your wheels turning.
Buffering.
Oh, this one's for you.
Oh, perfect.
What does a nephrologist specialize in?
Kidneys.
You got it. All right. What kind of doctor would you go to for issues with your digestive organs?
Give me some options.
Pancreologist,
Mm-mm.
digestinologist, nutritionalist, gastroenterologist.
That one,
Yep.
gastro.
Okay, this one's more in depth. What does a urologist specialize in? I'm going to give you your examples because these are pretty in depth.
Okay,
The urinary tract and men's reproductive health, the
it's
urinary
that one.
tract, the urinary tract and women's reproductive health,
Mm-mm.
childbirth and UTIs, all of the above.
It is urinary tract and men's reproductive health.
It is.
Mm-hmm.
Why just men?
Because you have an OBGYN for the ladies.
Oh, I didn't ask that. You're going to have to cut that out of there. I sound like an ignoramus.
Oh, no, that
What
one's staying. That's going to be a highlight clip.
Dang it, Kolbie. What kind of doctor specializes in diabetes, thyroid issues, and hormonal imbalances?
Endocrinologist.
Correct. What doctor would you go to for things like allergies, asthma, and eczema? You got eczema,
Eczema.
an antibiologist, an immunologist, a surgiologist, or a dermatologist?
An immunologist.
Correct. What are you laughing at?
The first option.
Antibiologist. Love that one. Duh.
Duh.
And finally, what does an obstetrician and gynecologist specialize in? Mental health, infectious disease, muscle pain, or women's reproductive health?
Women's reproductive health.
That is correct. I feel like those
Full
two go
circle
hand in hand,
moment
though.
right there.
Women's reproductive health, mental health. Thank you. That was good. Okay, that one was way too easy. Next week, we're going harder.
We got you.
Your quiz, though, your quiz, I liked it.
Top tier.
Made me feel
All
stupid
right.
and smart.
We're going to wrap it up.
Yes.
Give a special thank you to all of our fellow healthcare workers.
Yes. If you are considered essential, we love you. If you work in a hospital, an essential worker is not just your doctor or your nurse or your respiratory therapist. If you are in housekeeping, you are essential. If you work in the cafeteria, you are essential. If you work in transport, if you work in blood bank, you are essential. Basically, what I'm trying to say is if you work in any position in a hospital except for a CEO, you are essential. And we are so thankful for you. So seriously, thank you for being an essential worker.
Let's give them a clap.
So, had to throw that in there.
Yes. All right. We are going to wrap it up. Thank you guys for listening, and we will see you next week.
Woohoo! Bye, guys.